have a quorum, and I think it's 5:30.
It won't work, it's like having a continue.
Let's see, 5:37. I'd like to call the meeting to order, please. Any public comments? Is there anyone registered? No? All right. Approval of minutes for February 5th that were emailed to us. Any discussion? If not, let's have a motion.
I'll motion.
Okay,
The
we got the
minutes.
first. Do we have a second?
Second.
Second. Call for the question. All in favor? Minutes approved. Discussion and possible action. The first one, activities for National Drug and Alcohol Facts Week. Dr. Gonzalez had contacted Colleen and me to look at it, to go through maybe the Campus Crime Stoppers at UISD, which is where they have it up and running. And then I contacted Dr. Villarreal, who's the director at VMT. And she said, yes, they would be willing to. They have a department, kids take classes in it. So that way we can have kids from both districts involved and we can send it in for a national contest. Is there any discussion? Anyone have a better idea? Okay, that's good. Then that's what we'll be doing. For some reason, he likes to pick on us, right? And that's what we have next, education and promotion on drug and alcohol use and prevention. I did contact BMT to see if they could help us film something on vaping, because you had mentioned that, Chief. And so now we are going to, we have a script already, and Colleen has already gotten some kids working on it, the ones from UISD at the Crime Stoppers. So we'll have that very shortly. That will be ready soon, right? Because it's got to be for the month of March.
Yeah, so I put in a casting call for high school seniors to contact us through Laredo Crime Stoppers for not only this PSA, but several PSAs. Laredo Crime Stoppers has a grant to be able to produce videos and PSAs, so we're gonna go ahead and utilize that, since we know that through the city we've had some obstacles, and we wanna be able to get these produced almost as they are needed. And so with that said, we're gonna incorporate the National Institute on Drug Abuse for Teens and those statistics to be able to bring more awareness to the issue.
Okay. Are there any from the other?
I did, Madam Chair, I wanted to, even though this doesn't have directly to do detox, it does have to do with things that we talked about, the Drug and Alcohol Commission, regarding especially the committee that's heroin addicted. And if you remember back in October, we had a presentation from all committees on Vivitrol. And we discussed about writing a grant and getting some funding to do a reentry program for the heroin addicts in jail. And so I went ahead and wrote that grant on behalf of the Drug and Alcohol Commission. I did it pro bono, I didn't charge, because I thought that was part of our effort to do that. And Dr. Gonzalez helped out, and he was able to get, because the program is to provide medication and treatment to the inmates in jail that have heroin that are heroin addicts that won't be released and just die because they may overdose. This way they have some Vivitrol. So Dr. Gonzalez was able to get a lower price via the pharmacy here. I wrote the grant. I included the city of Laredo, because it's a grant that has to go through the sheriff department. So we wrote it in conjunction with the sheriff's department. They're going to be running it because we're going to be doing these services in jail. And the city of Laredo Health Department, so it's a true collaboration. City of Laredo Health Department is going to be providing the doctors, the nurses, and the pharmacy is going to be providing the Vivitrol, which usually costs about $1,000 per shot, at about $700, so we were able to see more clients. Pillar is going to do the assessments, the referral, and they were going to do the interim group counseling until they get referred to the different programs that we talked about, which include the drug court program, of course, SCAN, Pillar's going to have some services, or any of the programs that are available. And we are hoping to see that we just got notice, the reason I mentioned it today, we just got notice on Friday of the award.
Oh.
So we got the grant.
Thank you,
And
congratulations.
well, I think it's something that, it's congratulations committee, because I really did it as a part of the committee, okay? And because this is something the committee needs, and it goes to our discussion of using Vivitrol as part of our medical protocol in our detox. And so we're hoping to see in the next 18 months, approximately 180 heroin addicts that are in the jail that will be screened, have a comprehensive assessment, including psychological issues. We will provide them interim services through Pillar, and then they will be referred to right services. But before they're released, they will be given a shot of Vivitrol, which will prevent them from overdosing, like the young lady that died on Monday. I believe it was a young lady that died of an overdose. She had just gotten out of SCAN's Serenidad program. She had been in there for 90 days. She came out, and unfortunately, there's a 333% increase when someone gets out of a residence program to overdose and die, and that's what happened to this young lady. And so we want to prevent that from the people that are coming out of jail and get them into services and have them get easier access to Vivitrol, and that's what the pharmacy price will help, and we've got different agencies. So I think that this goes with our detox, because some of these clients eventually can flow into the detox instead of being detoxed in jail. And you know, of course, that will go for our next phase, which we will eventually be working on the residential to begin right after that. So I think that this is something that is a grassroots effort. Like I said, we've been doing this for many years. I was in the original iteration of this particular committee many years ago. And the difference in this committee is it's been a grassroots effort, and we've accomplished a lot in 1 year. And I think that this is just a good capstone to end the year, saying, you know what, this committee, and I know that Mara is sick, but I want to make sure that not only the city council, but the county commissioners know that this was an effort that came out of the Drug and Alcohol Commission, and it was a collaboration between myself, Dr. Gonzalez, and Pillar, but it was on your behalf. So I want to thank you for it, and you know, so we just got the funding, and we're hoping that we can help at least 180 people in the next couple of years. It's a governor's grant, so every 18 months we have to reapply and get the money, but I believe that once we show the efforts, we'll continue getting the funding.
That's what
Congratulations and thank you.
All right.
Thank you so
Thank you.
much. Are there any others of the work groups that would like to mention anything they're doing? Okay, then let's continue. And now we get to what we're going to do today.
Before we get to do with that,
Yes.
I didn't get to mention, but it's been weighing heavily on me. I'm sure it's been weighing heavily on everybody. You know, we lost Steve, and he was such a great member of the committee and such a great community leader in this effort. And you know, I don't know if we need to think of maybe doing something in his memory. A lot of, you know, you see the obituary, you know, it was strange, you know, you see him here and the next weekend he's gone, and I was in shock. I'm sure it's all of us. But I think that it would behoove us to make sure that the community doesn't forget Steve.
So maybe we could do something.
And I think that we ought to do something in memory of him. So that's just something that I'm throwing out there.
Yeah.
We'll talk to Dr. Gonzalez to see what we can do. And on the same subject,
Like maybe.
I know I haven't paid for the flowers that we got together to send to for his funeral.
Oh, yes.
So it's supposed to be $10 that we're gonna pay today. Don't leave without, she's gonna trip you at the door. And give her the money, and whoever hasn't paid, then we need to. We'll be hunting you down. I don't know, whose card was it? Who charged it? Dr. Gonzalez?
Yeah.
Oh, ha. Okay, well then, we'll have to get the money in for him.
I just
And-
wanted to add really quick
Yes.
on an update on the detox facility. Good evening, everyone. Richard Chamberlain, Associate Director here at the City of
That's
Laredo
right.
Health. Dr. Gonzalez asked me to share on behalf of him, he apologizes that he's not here this evening, that Lisa Piers, the health licensing nurse consultant at Texas Health and Human Services Commission, had let him know that the design has been preliminarily approved by HHSC, and they're waiting for final approval to post for the contractor, so that should be in the immediate.
That's great. It's moving along very, very well. Thank you so
Yes,
much.
ma'am.
That's the only update we have?
Yes, ma'am.
That's it?
Who do we
All right.
make the check out to?
What do we make the check out to, Dr. Gonzalez? She's making a check for the $10.
Dr. Gonzalez?
Yes. Okay, then we go on to the presentation by Heart that we're having today. And should I tell you what Heart is?
Yes.
Okay, I don't know it. I have to say the whole thing. Heroin Emergency Addiction Response Team.
So Madam Chair, this is Lieutenant Tinajero. Luis Tinajero, he's almost 30 years veteran of the Laredo Police Department. He's the one that has created this team, collaborating with various different agencies. Like I've said before, as part of this commission, you know, we've positioned ourselves where go beyond than just police actions. You know, we deal with these individuals almost daily basis. Let's us be the facilitators to the appropriate resources. And I'll let the lieutenant take over, but this is a great initiative.
Thank you, Chief. Good
Welcome.
afternoon, everybody.
Hello.
All right, so HEART, Heroin Emergency Addiction Response Team. So, this idea came out of a conversation I had with a friend of mine that's a recovering addict, and what I was trying to figure out, I'm real big on logos. I'm very military, so it's all, I like acronyms and all that kind of good stuff. So at first it was you know, for some reason this one came up and it fit perfectly because we're trying to change the narrative, not only for us as law enforcement, but trying to change the way things are done. You know, every agency's got a lot of red tape and a lot of hurdles to jump over. So we're trying to see there's ways that we can not do anything illegal or improper, but just try to speed it up. Because as you know, when a heroin addict says, I want help, you gotta give it to them right there and then. They don't have time for anything else, right? So we have to have a mechanism available so that we can provide it for them in lieu of other options such as arrest or anything like that. Okay, so the agenda. It's very short, guys. It looks like a lot of stuff, but it really isn't. I'll go through it real quick. That's the mission statement there. Again, we're focusing only on heroin, and that's it. Sometimes we tend to take a big bite of a lot of stuff. So, being one of the most obvious and most public addictions out there, I think that because the minute you walk in, you drive into Laredo, you see them out there already. So that's the first impression that people get, and throughout the whole city, right? And now we're not even trying to focus on the ones that are not on the streets, which I don't even know how to count those. But right now we're focusing on the ones that are obvious out there that probably need immediate help. Okay, so we're trying to stay away from the word coalition and the coalitions that are out there. We're trying to make it more of a team effort. That's why we went with the word team. It was, like I said, you know, the administration was very open to the idea. And so we were able to get together. In fact, I have some of the members from the team here, from the city of Laredo, of course, from the border region. We got Bethany House, so I appreciate them being here. That way, if you all have any questions, you can ask them. They are the experts. I mean, I just pretend to be one. Again, changing the conversation. I'll be honest with you. The chief can vouch for this. You know, when you come into PD back in the '90s and you saw heroin addicts, it was old school handling. Nobody cared. You know, get out of here, you freaking addict, all this kind of stuff. Things have changed. All right. Now we realize that it's not. You know, you got to see the human side of this. The ones that we need to go after, you're going to see one of them in a little bit. Are the ones that were the next step up, which is enforcing the laws that we have against the dealers, not so much the victims, which are the clients. Okay. So we're changing the conversation of, you know, from the crime of addiction to the actual disease, which is what it is. Okay. Like I said, we're focused only on heroin, and we're trying to structure it as we go along. We started back in August, and it takes a while. As you all know, this commission here didn't start overnight, right? I mean, they didn't develop to where it is now overnight. It takes a while. It takes the right people with the right attitude at the right time. right? The stars have to align, and we're growing that team with the right people as we speak. I'll talk about case management in a little bit. All right, so again, you know, very unique. You know, we got highly trained, highly motivated. If you are a supervisor of one of these agencies that are part of the team, guys, let me tell you, you should be very proud of what y'all have. I've been out there with them, the dedication they have to make the contact, to talk to them, to be able to have that rapport with them. That's not easy. You have to know how to speak to them in a certain way. You have to have credibility, and you have to have the right training of what to say and how to say it, right? It's not just go up, talk to them like you would a regular person. So you ought to be very proud of the employees you have. And the other one is that we have actually 3 of them. We have, you know, I call them consultants, but you know, they're recovery addicts themselves, so they give us a whole different insight. You know, when I'm opening my mouth and saying, why don't we try this, they're like, nope, that's not gonna work. So they provide us with real world experience that none of us, no, I couldn't be able to tell them, you know, tell the difference whether we should approach it this way or the other way. So that's kind of unique to have these members within our ranks. All right, lines of effort, and these are not, you know, set in stone, of course, but you know, the detoxification and detox center is coming up that you guys are working on is tremendous. I think it's going to help a lot. But that's just another Band-Aid, guys, on the big struggle. That's not the answer. I hope nobody thinks here that the detox center is going to solve all kinds of problems, because it's not. It's going to give us some more time, but at least it'll be another tool to work with. You know, more effective than waiting for Charlie Place or another place to send you. And of course, the end state is always to reinvent. You know, I'm in counseling on the surveillance side. I'm trying to get my degree in counseling. And so what I always tell people is, it's like when we have a hard time in life, it's like walking into a dark warehouse, right? You got one opening here, one opening there. You got to go through it. But when you come out on the other side, if you came out the same way you went in and you didn't learn anything, you wasted your time. You got to come out there a better person. Here, the same thing. When someone's been through the hell of an addiction, they should come out different. They're not going to come out the same way. There's different experiences, different traumas. So, and of course, everybody familiar here with the term emotional intelligence? Yes? If not, I got a whole 3 hours of presentation on emotional intelligence. That's my dissertation, so no? All right. Okay, so one of the big things that I'm big on is education. And you know, whether it's informal, formal, or just teaching them how to control their emotions. If we can do that, if we can reach these people at the right time in their lives and educate them, I think that'll give them not only self-esteem, but the power to, or you empower them to change their ways of thinking, okay? Now, yeah, we can control the physical aspect of the drug and how the body can resist it, but controlling the emotional part is more important, because that's what's gonna give them the strength and the actual, you know, lack of fear to move forward and not fall into the same trap. Okay? All right, so right now, the ones that are active, of course, the Laredo Health Department, Board Region, Emma and Scan. What am I missing? I'm missing somebody. Bethany House. I don't know what I put Gateway. Anyway, Bethany House, I'm sorry. Wow, gosh, she's here. But anyway, so those are the 5 active ones. We are gonna move to the next step and start inviting the 406 court and some other things once we get a better protocol on how we're gonna do this. Last time Dr. Gonzalez went to one of our meetings, and you know, I like it when the big dogs are there because they can make decisions on the spot. And he said, you know what, bring them to us first step. And then Chief Gonzalez said, well, we can use our patrol to transport them over. So now there's a process that's developing. That's what we want. Because once they bless off on it, then we have a system, right? Because it's always a big problem, right? Transportation, who's gonna take care of them, the issue of liability, and all kinds of stuff. So we gotta be just real careful on how we do this. But once we all work together and come up with a good system, I'm talking about actually picking the person up and taking them straight to the ones that are gonna help him or her at that time. That's what we're looking for, okay? Okay, so outreach, screening, assessment, and referral events, basically going out to the street and talking to them in their environment, okay? Right now I'll show you some pictures of the second event we had. We had it back in the 20th of February, a couple of hours. Of course, we learned that when it's raining, not a good time, when it's raining and cold, because they're not gonna come out. It's too cold for them, which I don't blame them. So we went to Danny's and, fed the local economy for an hour. It's always producing, right? And then, the time of day, also, you gotta, it's weird how the different factions have different times where they go get their supply or their need, and then they come back, and so we're trying to figure out what the best time is for the different locations. Again, learning as we go, okay? That event was 14 males, 1 female that we contacted. And then, Dagoberto here got a chance to actually test the 1 male. Of course, and guys, this is nothing new for you. You all see these type of situations. There's Dagoberto running for mayor. Maybe not perfect. That's the 1 male that he was able to test. And I'll talk about him in a little bit. That's him right there. So, I am very interested in this guy. Because he's early 20s, he's just started doing it. So we're trying to grab him right now as fast as we can before it gets worse. So you can tell he's not having a good time, So next time we go out, I think in a week, we're gonna start looking for him first and see what we can do for him, okay? As opposed to someone that's been doing it for 30, 40 years. So we're gonna try to see what we can do with him. Again, this is what it's scheduled for next time. Again, just thinking out loud what we need for it. And this is one of the faces of the evil that's out there that's supplying these people. This is on Facebook, so it's nothing that's secret or anything like that for y'all. But this guy was even narcotics hit the house, and he flushed all the drugs down the toilet. So, but we did get him with some scales and some phones and stuff. But these are the type of guys that are causing these problems, okay? So I'm gonna have a conversation with the boss and come up with a game plan on how to disrupt the operation. Because right now, I know in Bethany House, you all see it all the time, drug deals out in the open, I mean, it's ridiculous. So we're about to come up with a plan to disrupt that, okay? At least make them work for it harder. Because right now it's easy. They rent houses in the area, come in a bike, drop it off, go back. It's ridiculous. They got pre-ring right now, and not for long. I mean, that's what they got caught with. All right, so our current challenges, everybody's right, funny, right? Of course, like I said, we're trying to figure out how to do this best. It's gonna take a while. With expertise in this room, there's years of experience, so it's just establishing a conversation on how to do this better and more efficiently. The term on there is funding. Again, in case you all missed it. And then the client buy-in, right? Establishing a rapport with those clients to where they see us as help and not someone to run away from. When I go out there with them, I'm not in uniform, and I'm just in fact, I'm not even making contact, because you can spot me a mile away even though I'm not in uniform. But I'm there basically just to provide security for them and make sure that nothing gets crazy, okay? Oh, and the very last thing, in case you missed it, is funding. All right, so the way ahead, again, continue to analyze and assess how we can bring everybody together and put everybody's capabilities together to expedite the process, all right? And I think that once we start helping people and they realize that there is a quicker way to do this, then I think the word will spread out, will spread, and we'll actually be getting called like, hey, I need the help now. That's the goal, that's the goal. I mean, it's in a perfect world, that's where we're trying to get to. Case management, again, we're using Mr. Bustamante there as the first example of how we're gonna do this. So, depending on what he needs, where he's at in his struggle, we'll figure out which agency best, is best suited to help him at that time. Of course, continue the all-star process, better timing and all that good stuff to attract clients. Aggressive law enforcement operations, again, we are gonna disrupt them very soon. They're not gonna be happy with us. And then we're also looking at the bigger picture, not just the client, but the family. Trying to figure out how to provide support for the family themselves. Give them the power, give them the knowledge to continue helping, because they're more impressionable than we are. The friends and family, if they're not there as a backup, we can detox them. But the minute we put them back on the street, they're gonna go with what they know, right? They're gonna go back to their environment. So we can provide a different environment for them, You know, through education, through training, through job opportunities, whatever, religion, whatever works at this point. That's what we're trying to find out, you know, how to do it. And then, again, as we identify different agencies that can help, you know, outside the box, with donations, whatever, well, we're trying to develop that process. I'm not even gonna tell you the last one. And the funding, basically, right now, guys, what we're looking at is, it costs money for methadone, right? For any type of drug that's gonna replace heroin. That's what we're looking at. Everything else, the directors, my bosses, their directors have been real good about giving them time during work to go and do these All-Star events. Eventually, it's gonna get to where we might have to do a weekend or a night mission, whatever. We can work through that, but the thing is that they've been very receptive and very supportive, so that's what's making this work, okay? Besides the fact that the team members are very motivated and dedicated to what they do. So, that's my presentation. Any questions or any questions for the team? Yes, sir.
Yeah, Officer Tinajero, I
Yes.
appreciate everything you're doing. I think that, you know, when we originally had the presentation from the chief, I think this is a wonderful idea. And I really believe in this effort. I wanted to give a couple of suggestions.
Yes, of course.
First of all, not only does the city of Laredo, but Pillar, and I don't know SCAN, I can't speak for SCAN, but I know the city of Laredo and Pillar, they have outreach teams that go, they have TCE HIV programs. So they're out there looking for HIV, and we know that a lot of transmission for HIV is done through needle exchanges. So there are already teams out there that maybe you can partner with, your staff can partner with, and you all can go out together. So working with the city of Laredo, working with Pillar, getting a hold of Manny and Arturo at Pillar, Dr. Gonzalez here, and having a meeting, I think would be beneficial. Now, the idea of the detox, we know that it's not a panacea, but the thing about detox is you're not gonna have to go through the OSAR because it's not DSH's license. In other words, anyone can go in. And that's gonna help us. And we have a second phase that we're working on, which is add more residential beds here. And even that is not gonna solve the problem. We know it takes a lot. And so I appreciate what you're doing. And the other thing that you mentioned was the drug court. Now, I'm a psychotherapist, but I'm also Judge Hale's evaluator for the drug court and his grant writer. And I can let you know that, you know, if you have referrals, you know, send them, you know, the OSAR should just immediately send them to the drug court team. And every Monday, there's staffings, and we can start moving them up the list. Because we see approximately, I want to say, nowadays we're seeing about 125 new clients a year, and more than a quarter of them are always heroin addicts. And it's actually topping that number right now. We're bringing 5 new people this week or next week. They're all heroin addicts.
And Jesse, I have a question. They have to go through the drug court?
Yes, so they're gonna have to,
be pending?
number one, they have to be, have some charges. The DEA's office is gonna have to approve them. They're gonna have to go through the whole process. They're gonna have to say, yes, I'm willing to, instead of in lieu of these charges, I'll go through the drug court program, which is not easy. It's a minimum of 13 months of intense services, and it can be up to 18. We've had some people a little bit longer, but there's services that are for co-occurring psychiatric substance services. We have LPCs providing services, so we take care of the mental health issues. A lot of people look at the substance use and they think that's the issue, and it's a problem. But the real issue is psychological nature, and you have to treat them concurrently and aggressively. And you know, we work with Board of Regents of HMR, we work with whoever we can, but the drug court, you know, that's another key person to have in that meeting if you have one with the city. You can always call Lupita Palomo, who's the director of the program, and she'd be happy to help guide you through that process, because we can see plenty of clients, and right now we have such a high use of heroin in our community. And I go back more than 33 years, and I remember when, you know, I knew Dago Carmona when he was a client at MHMR before he even was, when he was still not even in recovery. You know, when he was at the Basta clinic. And, you know, I saw Dago, I saw all the changes he made, I saw him get in the community, saw him get his bachelor's, his master's, I saw him get his LCDC, I hired him in different programs. He's a good friend of mine, he bought my son his first fishing rod. And we used to talk about the stories of the old days where the old Tecatos would tell the younger people, don't use these drugs. As a matter of fact, sometimes they would get upset, they'd hit them, and they wouldn't, you know, they'd chase them away. But over the years, because I ran residential programs for adolescents for many years, for a good 15 years of my career, and I saw the change where by the mid-1990s, you were seeing these kids, and I would see 12-year-old kids with crack marks, with hepatitis C, 12 to 18-year-old kids. And in 2001, Laredo had the highest rate of admission for adolescent heroin addicts in the state of Texas. And they weren't dying like the kids in Dallas because they were being taught how to use heroin by the older ones. But what happened with these younger kids, they didn't have the values that the older Tecatos had. You know, it was different. And so you had a lot of other psychological issues going on. And the problems got progressively worse. And now some of the kids that I saw in the late 90s and early 2000s, I've seen them as clients in the drug court. I've treated grandfathers, fathers, and children. And for anyone else, I don't know if anyone else has been in the field as long as I have. I mean, it happens. And I'm sure you've seen it in your career because you've got a 30-plus year career and you've seen all these changes. And so I really want to commend what you're doing, Chief. I think that this is a great effort. And I think on my part, you know, whatever you need, I'll be happy to help, including even the funding. You know, a lot of grants that I do, you know, a lot of them, of course, I have to make a living, and that's part of my job. But I do a lot of stuff pro bono, and I can let you know that there's a lot of wonderful grant writers here, including Margarita, who just wrote a wonderful grant for Pillar. And there's a lot of people on this committee that can write grants, and we're willing to help out. And again, I think that whoever has this ability ought to do it as part of the Drug and Alcohol Commission. Okay?
I appreciate that. You and I are gonna get on each other's Christmas list after this, because that's what we need, and that was the whole goal of coming to meetings like this, to, you know, do the networking and find the right people for the right thing.
And by the way, there is funding now for medication-assisted treatment. And the medication-assisted treatment that we are proposing in our as part of the commission is based on a lot of what the work that I've done over the last 11, 12 years with the 406. We started using a medication for Alkermes called Vivitrol, which is injectable form of naltrexone. And the reason why we like it as opposed to methadone, which is highly addictive and you have to go through withdrawals if you get off of it, or Suboxone, or anything else that, you know, that is that can not only block it, but it also can provide you dosing of the opioid. Naltrexone, or injectable, or Vivitrol is injectable. It actually blocks it blocks the opiate receptors and the dopamine receptors, and so it's not addictive. All it is an opiate receptor blocker and a dopamine receptor blocker. So in other words, you can't use heroin. You won't even have cravings for heroin after a while, and if you actually use it, you'll go into immediate withdrawal and end up in the hospital. But you won't be able to use it for 30 days. And because you won't get the pleasure, because it's a dopamine receptor blocker, it works for heroin, but also for alcoholics, because once they drink, they won't have the craving to use. And so we decided after this meeting in October to use Vivitrol as part of our medical protocol for our detox. And what I'm suggesting is that we do have monies, and Dr. Gonzalez was mentioning when we were trying to figure out this grant, that they had just gotten approved, I believe it's the city of Laredo, had just gotten approved for some of this money for medication-assisted treatment that has been provided through federal block grants to the state of Texas, and I believe the city of Laredo, and you can correct me if I'm wrong, and we're going after that. But I do know that there's much lower pricing here already because of the pharmacy here. So there's a lot of opportunity, and I am a big fan of Vivitrol. I don't work for Vivitrol, I don't do work for Alkermes, but I know that it works. And Margarita, you and I were there when we started the program, the 406, and we saw it worked. In the first 3 years of using Vivitrol, approximately, about 25 patients a year, in 3 years, more or less, we saved our community $560,000, a little bit more or less, with people going to jail, going to hospitals, arrests, having to have your police officers at the hospital, all of that stuff. When I did my evaluation, it was about $560,000. The grant that we had for those 3 years was, what was it, $975,000? So with that $975,000 and the money they gave us for Vivitrol for 25 clients a year, we were able to save the community all that money. And so I hope that we can continue having this conversation. And also when we found out about the grant, the people from Alkermes and Vivitrol, they'd be happy to come and help you all out and give you presentations on this particular medication, which I think is very good.
Very good information. Thank you so much. From the ones I've had today, anybody? Jerry, you want to say anything?
The only comment that I heard Mr. Hernandez say, joining forces with Pillar, duplicating the HIV component will be doing the HIV testing, but will be duplicated. So
Yeah, I wasn't talking about duplicating, because you're with the heart team, right?
with the HIV department.
You're with the HIV department
Yes,
for,
with the health department.
right, but are you part of the heart team?
Yes.
Okay, so what I'm saying is that that working with Pillar, I thought there was another whole outreach person other than you and the city of Laredo. So we are going out with the city of Laredo. I'm not talking about duplicating. I'm just saying that maybe since I didn't realize that you all from the city were doing this. What I'm saying is that maybe Pillar can be on top of this, and as they're going out and looking for their cases, they can become part of the heart team. And so now you have a whole, we already have the city here, but Pillar has 2 HIV programs that they do outreach with. So that HIV staff can go out and be part of the heart team
Enhancing.
Exactly. And so it would enhance, because I saw you, and of course I've known you for years, but I didn't think that you were the heart team guy. Okay, but now I know. So then just adding Pillar would just be, okay, so now you have more staff going out and doing it.
Pillar is one of the, like I said, and I did all my internship with Pillar, so I'm very familiar with many. So that's the next step. Is that Pillar 406 says we're trying to make, go to expand our team and bring some more people to the table. So.
Well, I know there's a lot of people that want to help, and I think we talked about the card. You had to talk about that card.
Oh, yes, the card.
I think we need to follow through with that card.
We are, in fact.
Okay.
Thank you for bringing that up. My boss is right here.
Yes.
I failed him. Well, thanks a lot. You know what, Jesse? What do you drive? But yeah, we are working on it. What my struggle right now, I need to get everybody's, get the little logo in there, get all the numbers in there, and make sure that our guys are out there giving them out.
Well, I think the most important thing are
way.
services, right? So the services come first, but I just know that was one of the things that was brought up.
And that's one of the projects that.
Yeah, like I said, I'm working on it. But thanks a lot, Jesse. Anybody else? Jerry?
Well, I guess, is there on your program, Pillar,
I don't work with Pillar. I'm a consultant with different agencies. Pillar is one of them.
but since you mentioned Pillar,
Yeah.
is there a waiting list?
Now, Pillar probably has more openings or more availability. I do know that they have a waiting list for the general population that goes in just for counseling. And I know that because I supervise a lot of their LPCIs. But I believe that if they qualify for one of the TCE HIV programs, whether the one that's funded here in Laredo, where the city of Laredo participates, or the one that's funded out of Corpus Christi, and they provide services here, there's more availability to go in, so there's more open slots, as long as they are high risk of contracting HIV. And I believe that anyone that uses heroin would fit in that category. And SAMHSA has allowed the program to not only target, the original idea was to target the gay community, but because in the past we were targeting primarily heroin addicts. They've allowed anyone who is at high risk, including heterosexuals, male and female, that are high risk to be able to go in the program. So they have more availability there. And I know the drug court, we always have a waiting list, but and we work with the DA's office to move it through quickly. But we have the capacity to have clients.
Okay. The reason I'm asking, touching upon that waiting list, because that is one of the struggles that we have when we're doing outreach.
Yes, of course.
January 23rd, we did pit count. Pit count basically is all over Texas at the same time,
Right.
from 8 in the morning to 10 p.m. And we go to different locations to basically to assess the people that are out there, get information from them. And this year I came across 2 individuals who were ready to get help
And they need the help right away.
right away. Unfortunately, because of unless we come up with a comprehensive plan that everybody's in the same sheet, we're gonna struggle. With every agency in here, we all have different criteria and policies,
Right.
and that's what stuff the individual getting help. This
That's the whole
individual-
premise, that's the whole premise for this thing.
Yeah.
Exactly what he's saying, because every agency that, since they got here, I'm like, all I heard was, well, we need this, we need that, okay. So that client's not gonna, he doesn't care about a birth certificate. He doesn't care about IDs. He wants that help right there and then.
And so, going back, go ahead.
This individual, she needed help right there and there. Following day, I went up to pick her up, get her services. She wasn't ready. She was having a withdrawal. She needed to fix. I turned around, went looking for another person that we needed to get help for. And when I turned around and came back, she was talking to an individual, and as of that day, I have not seen her. She's disappeared.
Okay.
And she's a heroin addict. Just at 17, I had a veteran who was a heroin addict.
Now, with the veterans, we have a veterans court program.
Yes, I'm very familiar with that.
Okay, and they can just go right in, and I'm the evaluator for that one. We have plenty of slots available for that.
Unfortunately, not to talk bad about certain organizations, this individual, they failed them. Okay, he died September 27, 2017. Okay, we work with him, veterans program, providing him this, and because it's like LT said, because he was homeless, nobody wanted to approach him. I dealt with him month after month. We finally put him in a nursing home. 6 months later, he passed away.
Mhm.
But because he was a veteran, because he was a heroin addict, nobody wanted to talk to him. And the main problem was the waiting list. We've had individuals, not just veterans, but homeless individuals who are ready right then and there. But because there's a waiting list, and because some people will not go out there, because the program's not set up for outreach, is make the phone call, get evaluated through phone, and then put them on the waiting list. These people cannot wait. But unless us as the Board Region, Health Department, PD, or anybody, but unless we come with a business plan that we're all on the same sheet of music, we're still gonna continue struggling with this.
Right. And I agree,
Epidemic.
and it is an epidemic, and, what happened is horrible. No veteran should ever be treated like that. That's my belief. No veteran should ever be treated like that. And no individual, you know, whenever I run programs, I have told the staff that I work with, I said, I want you to treat them the same way we run a family member treat. If they were in some situation. And so I understand that different agencies have different criterias because they're funded by different agencies, and different things are going on. Like, for example, you go to MHMR, you have to be a citizen. You go to SAMHSA, well, nowadays you have to be a citizen, when in the past you didn't have to be. However, the services that, and some agencies have them, like Pillar has services where, that are pretty much pro bono, free, and they can take those people. Now, in the jail, let's take the new capacity that we're building for 180 people. They're not asking you in jail if you're a citizen or not. So anyone who's a heroin addict in jail will be able to access this program that we just got funded for, and they'll be able to go to the services that Pillar has through this grant, which include the group counseling and all of that, until we find them a place. But you're right, it's very difficult. You know, in the old days when we had residence programs, it didn't matter if you were a citizen or not. Nowadays, it does.
And the other thing that LT mentioned about, we have individuals who do not have social security card.
Exactly.
Or ID.
Exactly.
So if we send them social security officer, the social security card, they're gonna turn around and send them to DPS, they get an ID card.
Yeah.
They go to DPS, ATS, to send them back to social security because they don't have a social security card, so we can't give them an ID card. So we have them going back and forth, and somehow that needs to be fixed.
Yeah, the type of case management, I believe the case management that, and you all had a training on it, the type of case management needs to be done with this population. And I believe the city has already started, I heard that they had a training, is the wraparound services where you go ahead and you actually follow the client. You cannot say, here's a referral. You know, you have to make sure that they're there. And so, am I right? You all had a training recently. I know somebody told me, right? It was on.
I am not 100% sure
Okay.
on the training, but definitely that's something that we can.
Yeah, and so I know that in a lot of grants that I've worked on recently, when we're talking about case management services, we are talking about making sure that the case manager who's assigned will make sure that that referral, it's not just here, go there. No, we're supposed to now take them there. And actually the government is now asking for those type of services. So that will help.
It will help. So part of the response to that struggle is, of course, I got to go to the chief, but we're trying to set up a database at PD where all the identified clients, we'll help them get their stuff, that whatever the agency needs, whether it's, you know, a birth certificate, social security, whatever, but we'll hold it there for them, because they're not gonna carry it, they're not gonna take care of it.
And they can lose it.
Right, but if we know who, you know, this young guy is, all we gotta do is, if you don't have anything, that's fine. Call PD, here it is, let's go get it. Let's send it to the phone, here's the ID scan, here's the ID, you know, whoever needs it. See what I'm saying? That's, again, another way of circumventing the struggles and the challenges that we have right now.
So what do you think would be, the solution? You must have thought about this already. What do you think would be the solution so that we can help these people, especially the homeless? I know I've written a homeless grant, I've done different things, but what is it that you think is the solution for this? What would you like? If you had a wish list, what would you like?
That we need to come out with a plan with all of us. Right? If I send them to Board of Region, I don't wanna hear
That they were bounced.
it was bounced back because he didn't have what, social security card, ID, or X reason.
Exactly.
So if the city department says, well, send them over here and I send them over there, to the city department, health department, and they say, well, he doesn't have an ID, she doesn't have an ID. We turn him away. So that individual that's ready to be held, he's gonna go back.
Right.
But I know it's hard, and it's in a perfect world, and we all send somebody else, they're gonna help like that, but because we all have different rules, policies, and procedures, I know it's hard. And that, I'm pretty sure it's considering everybody here.
Okay, so
But-
then.
And I don't think, so I was talking about it earlier, I don't think we're already at the point where we need another focus group or have somebody do a study. We already know what the problem is.
We know what it
need
is.
Solutions.
Yes, so then the idea might be to find one or two counselors that are not funded through DSHS or SAMHSA, because they have their rules, right? So you go to MHMR, you go to SCAN, you go to anyone that has funding in those areas, it's gonna be very hard. But what if we could find some counselors that could do screenings and assessments, and they're not getting funding for it. In other words, we look for funding that, you know, that doesn't come from the government, or we find a mechanism to pay for these staff, and we find a place to house them, whether it's Pillar, the base, or the city, or wherever, and that could be the central location where if you need somebody immediately to be assessed, that they can go over there to be assessed. Because the Ozark can't take them, because if they're not citizens and they don't have all their paperwork, how will they be seen? But in the meantime, if we can find at least two counselors who could probably see about 8 people a day, if needed, you know, to do a good assessment, maybe 6 to 8, let's say. But if we could find two counselors.
And that's what we were talking about. Having somebody, like today, it's like today I'll be the one that carries the phone.
Okay.
If I see somebody and I need somebody to assess that individual, when I make that call, like, at least I would expect for that person to go where I'm at and assess that individual right there and there. And not tell me, get his name and mañana voy.
Oh, no. It has to be immediate. Now, would you all have,
Individuals that are ready right there and they're ready.
would you all have the capacity to take them somewhere?
That's what we're
That's
talking about.
the other thing.
Okay.
That's exactly, so you're asking the right questions. We're not there yet. Give me a couple of months and I'll come back with a.
Because I supervise a lot of LPC interns, and they are always looking to get hours because a lot of them can't do it at work. And so the idea I have is maybe you provide a small stipend to some of these people that have already passed their national exam, they've got their masters, and they're looking for hours to become an LPC, and they can become part of this team. You know, it's kind of like what AmeriCorps does, you know, where AmeriCorps pays stipends to young people to be in their service for a year, and they provide service to the community in one way or another. Well, maybe with a small stipend, you know, like AmeriCorps gives, you know, it's not much, but we can have a group of people that are coming out of TAMU that have just passed the test and that are looking for those hours. And maybe that would be the team. I mean, I'm just saying, you know, there are enough people out there that want to get hours. I mean,
Again, another option, another good viable option, so, yeah, I mean, definitely, the challenge here is gonna be, and I'll be honest with you, I would rather see people wearing the suits, talk to each other, and maybe amend some of these policies and procedures to where they're more compatible with each other. That way, we don't have to be at this level, trying to see how we can circumvent certain ones. That's gonna take a while, I got that.
yeah, you know what? That's been a struggle that, as an administrator, when I was an administrator many years ago, for 33 years, that was a struggle that I had and arguments that I had. And we'll continue going in circles because a lot of these, you're talking a lot of statutes and laws that are federal and state.
Right,
And,
so it's gonna take a while, it's gonna take lobbying, it's gonna take a while, but, so we're gonna work on it from the bottom up.
and so then the idea is really to circumvent with people that are not working for a funded agency. And you just have a site and somebody donates a site and you make sure you can bring them, and we have phones and on call, and we say, these are the expectations. Do you want to sign on for a year? Here's a stipend that you get, $1,000 a month.
What we need is a pro bono grant writer
Well,
to get us started.
well, you know, Marina knows that I do this. I mean, look, I don't mind doing this because I really do believe, I went to St. Joseph Academy and we were taught that we had to leave and come back and give to community, and I left for 14 years. And in my practice, 10% of my work is pro bono, because I've been blessed. I see a lot of clients, and I have a lot of good contracts that allow me to do different things. And I actually have the lowest prices here in Laredo for psychotherapy. I do know that. My wife always gets pissed off that I don't raise them, but I want to see people.
Yeah, you
I started working with indigent population, and I want to continue working with that population. And there's many times I do pro bono. I have clients that call me that I've worked with, or that I know, or veterans. I treat a lot of veterans pro bono. So pro bono is a way of giving back in the community, and I believe all of us here do pro bono work.
To a certain point, yeah.
It's very important.
Yeah, real quick, so we can end this. Did you have something quick?
No, well, a little bit. We're doing the outreach is there. The people to go out and do the assessments is there. We have the counselor that joins us, our team, the social worker that join our team, case manager join our team, to be able to go out and reach out to these individuals. Problem is getting the hour time of every agency to be able to get them in somewhere, place them by the time, let's say they could take them to jail in the meantime, until an agency opens up or whatever, to go out and enroll them in their program to continue the services. But even the aftercare, yes, okay, when the detox opens, they go in afterwards. Housing, we all know that it's very limited. And if you put them back in that environment of wherever they're at, they're gonna, chances are they're gonna be in the same situation all over.
Right.
Jerry and I, we've been in the homeless population for a very long time, and housing has been the #1 issue for everybody.
Yes, it is.
So on that note, I'm sorry to cut you off, but on that note, I'm a lieutenant colonel right now in the reserve, and I've got contact at Fort Sam. I'm trying to reach out to them and trying to figure out if we can have some of the training battalions come through, set up tents somewhere and use them. I mean, it's federal money being used for real actual training.
Yes.
And I'm talking about possibly a holding area real quick until we can get them to the right place. Now, long-term or short-term housing after that, that's a whole different animal.
You know, I'm okay with the holding area being anywhere but close to the detox program. You know, I know that they talk about it in one of the city council meetings. I'm not for that, but I agree that there's a lot of people in the community, and I'm a Rotarian, and there's a lot of Rotarians that would want to help if we had some direction. So, you know, we don't have to reinvent the wheel and have another focus group. We just have to have phone calls and meet at lunch or here or wherever and figure it out.
And that's one of the things that when we started, I told the group, look, leave the egos in the door, leave them out there. When it's not about what organization can make the most money out of this or get the most clients, it's about helping. If we can help one person out for the whole year, we've done our job. So, but it's hard though. It's hard because they all come in institutionalized. We all come in institutionalized. We gotta get past that. You know, like people from Blessing House that leave in the middle of the stuff. So, bye. So anyway, so guys, I really appreciate your time. I do need to get your number, sir.
I'll give you my card right now. Yeah, I mean,
whatever
whatever you need, you know, I'm willing. I worked with adolescent heroin addicts for years. Unfortunately, I've seen a lot of young people die. You know, and people that clients that I've worked with, and from every background, economic, socio-ethnic, it doesn't matter. I work with a lot of very wealthy people, and I've seen their children die, and I've worked with an indigent population, I've seen their children die. And I've been to funerals, and you know, I've seen the heartache. And I've had to work with counselors who experience a heartache of losing a client for the first time. And I went through that many years ago, and it's very tough. And so whatever it is that I can do, I mean, the reality is that, you know, all of us are here because we want to help. And the commission is here because we're a grassroots effort and we want to help. All of us are giving our time. And whatever it is that you need, I know that you can count on the commission. But I'm speaking out here because, you know, I'm here. If you want to use me as a resource or whatever, I'm willing to do it. And, you know, I'm not going to charge you. Why would I charge you? Because this is for the community.
We really appreciate that. Chief, any other?
Good job.
Yes, you got it.
Good job,
Thank you for your
team.
time.
Thank you,
for your
sir.
time.
Yeah, thank you very much.
Motion to adjourn? Please. Motion to, thank you. We have a first, do we have a second? Guys, second motion?
Second.
Thank you. Meeting adjourned.